Greetings, everyone, and welcome to today's episode of TNCEAL Wellness Wednesdays. I am Dr. Katherine Y. Brown, your host. Today, I am so excited to introduce you to someone who I met probably a few years ago, but she is an absolute trailblazer, doing amazing things around the nation and the world. Please join me in welcoming Dr. Parinda Khatri. Welcome, Dr. Khatri.
Thank you. Thanks for having me.
Oh, I am so honored and excited to have you. I think I still have our pictures from when I came to visit.
Great.
So, I like to keep the conversation on Wellness Wednesday more just open discussion. So I didn't want to read your formal bio. Rather, I would like you to share a bit about your background and your work with our viewers, because you are a powerhouse and it's amazing to have you in Women's History Month. This is historic episode.
Oh, well, thank you. That's very, very kind of you. Yeah, so I am currently the Chief Executive Officer at Cherokee Health Systems. Actually, I just assumed this role February 1. And I was Chief Clinical Officer for about 7-8 years before that. And then before that, I was Director of Integrated Care. So the past 21 years, really, I have been at Cherokee Health Systems, and it has just been a blast. It's been wonderful to grow within the organization. Cherokee Health Systems we call ourselves the hybrid safety net. We are a federally qualified health center. We provide integrated primary behavioral health, substance use disorder services in 13 counties. We've got clinics serving people who are experiencing homelessness, clinics serving people who are in public housing. We have clinics in rural areas, a migrant health center, and also, family practice, integrated family practice clinics in the suburbs. And so we really are family-based and responsive to the community needs. But we are also a licensed community mental health center and a licensed alcohol and drug treatment center. And this really has been a hallmark of our model of care since the early 1980s. We have been an integrated delivery system, and we are seen as an exemplar, I'm proud to say. And we have lots of amazing people like you who come and who visit. It's more on Zoom now because of the pandemic. And then we go out and do quite a bit of training on integrated care, because most people realize that we have to treat the whole person. Yeah. And so with that, as a community health provider, advocacy, just like I love being in the trenches and seeing patients. I'm a clinical psychologist by training, and I think being on the ground is incredibly important. But I'm also involved with a number of national organizations. I'm on a number of national advisory councils, very active in advocacy for, high quality healthcare for everyone. Yeah. And so with that, I really have the best of both worlds. I think I get to get my hands in the daily activity of taking care of people, but also am able to be part of a collective movement to healthcare for all.
I love it. I love everything that you're doing, and you're transforming lives, and you're doing it the right way. I call it the Cherokee way of doing things. You all do amazing work. So how has the COVID-19, how did that pandemic, but we're still in, impacted your work and those who you serve?
Oh my goodness. I will tell you, it turned us upside down, up and down, everything. Right, left. The first few months of the pandemic, I don't think any of us slept for more than a few hours at a time, because we, as a healthcare organization, we couldn't shut down. We had to see people, and we were being called to be part of testing, to be part of, the community response. And at the same time, we had to be a safety net provider because so many people lost their health insurance. Remember, a lot of businesses closed, so we would have lines of people who didn't know where else to go. So we were part of and continue to be part of the first responders. So when you ask how has it changed us, boy, it pushed us to the limit. And when we thought we had nothing else to give,
yes,
we thought, this is it, we're done, we're spent. And then the Delta surge hit. And then we could barely breathe, and the Omicron surge hit. So I think, how the pandemic has transformed us is, number one, it showed us how strong and resilient we are. Mm-hmm. Number two, it has, just like you've seen it with SEAL, a gift in it has been the community collaborations. SEAL has brought people together who, we all really like working with one another, but it really took an international global emergency for us to get out of our everyday work and say, okay, how do we work together to respond? So, I think in many ways it has reinforced our role as a community health center, and it has challenged us, but it's made us stronger. Saying that, I think we're all ready for just a bit of a breather. We just want some regular normal.
Yes, we would not reject that at this time.
No, we would not, just for a little while.
So this is a two-sided question. What do you feel has been I would say the biggest challenge? And then I want you to tell me your greatest success. And you have had a lot of success, but I want that one that just warms you in the inside and you say, you know what, team, we did that and we did it well. So
yeah. Those are, you don't ask the easy questions. So, at all. So I would say, it is two sides of one thing. Mm-hmm. I would say trying to navigate in the face of uncertainty and factors out of our control. So you remember the first year of the pandemic, we didn't know. I go back to those emails. We didn't know clearly the mode of transmission, and we didn't have any vaccines. We didn't know what the world was going to look like. And so we were pivoting and changing every day. Screen for this, add these screening questions. We don't need these screening questions. This is our schedule. We moved so many people to virtual, but we had to get comfortable in every day we made mistakes. Every day we screwed up because we were just trying whatever we could. So I think that the greatest challenge was every day the decisions we made were just a bet. It was just a hunch. Let's try this, let's try that. And so that intensity of moving forward, because you have no choice, in the face of not knowing 80% of the variables, was incredibly challenging. And to do it day after day, week after week, month after month, that was hard. That was really hard. The flip side of that, what I'm so proud of, is this innovation and creativity, the spirit that came from having to just, in a way, we threw out what we knew how to do because it didn't work. The usual ways didn't work. So we would say, this is where our mobile clinic came. We didn't have a mobile clinic. All right, let's just get a mobile clinic. Let's get this. Let's put a cooler, and just set up a tent and partner with the school and do testing and do vaccinations. So the one thing that I will say is the community partnerships and us going and really writing a different rule book, a different guidebook, and knowing that whatever was thrown at us, yeah, we could handle it. And some of these stories, I'm sure you have those too. You can't make these stories up.
You can't script it.
You can't script it. You can't, people wouldn't believe it if they hadn't seen it. But I will tell you one story that sticks out to me was one of the very early vaccination events we did. We were vaccinating people in a very rural area, and we looked over one of our staff and they saw an elderly gentleman sobbing in the car. So she went over. She was really worried. What happened? Did we hurt him? Did something go on? And she said, "Sir, are you okay?" And he said, "Oh, I am wonderful. I finally get to see my grandchildren because I'm vaccinated.
Yes.
I have not been able to see my grandchildren." I mean, what a gift that we were part of that. And it really, the whole thing was something we just set up in a parking lot with a tent. So that story just strikes me as, honestly, I'm sure that there are thousands of success stories like that in each of the people with whom we worked during this pandemic.
Absolutely. And you made that possible, your team. So kudos to you all for doing great work. So what do you have going on, right? What do you want to share? Because again, you're doing so many different things, and I want
so many different things.
Yeah, and for our viewers, I really want you, please share your website, because they really have to go to your website to get a glimpse of what you're doing, because I didn't fully understand it until when we came on site and we did a tour, and I was like, this is amazing. So just what is it that you want to share? And it can be anything.
No, I'm very excited about, so many things that we're getting into. And now that we are, fingers crossed, slowly going toward the tail end of this pandemic, or at least to a place that it's an endemic, it is all of the new programming that we have been developing, and then really building on the outreach program. So first of all, our website is www.cherokeehealth.com. And you can also Google us, Cherokee Health Systems. Our base is in Knoxville, Tennessee, but we have clinics in Chattanooga and Memphis and all throughout, rural Appalachia. But I'm excited about so many things. Number one is our Wellspring program, which provides care it really addresses endemic of HIV, hepatitis C, and substance use disorder, particularly opiate use disorder, because we're seeing a lot of overlap in this population where people, unfortunately, who have, opiate use disorder, they may be using needles that are not clean, and then they may get HIV. So we are really looking at it as a syndemic model, an integrated model, and recognizing we can't silo things. So we have this team of people who are experts in all of these things working together, and just building and growing that program is very exciting, because that is life-changing. And that is also expanded to, HIV prevention with PrEP and PEP, and being able to be in that space is very exciting. And we have a very passionate team involved in that. The other kind of development that is exciting is expanding our school-based work. We recognize that we have to, children we have a special place in our heart for children. We are building, telehealth programming where we already do telehealth into 26 plus schools with our pediatric nurse practitioners. And we also have school-based therapists going to a number of schools. That is expanding. We have wonderful partnerships with Memphis Business Academy in Memphis, and also Emerald Academy. Both are charter schools in inner city areas. We actually have a clinic in a facility that is as a community center. It has music room, it has soccer, baseball, in one of the most high-risk neighborhoods in our community. So lots of partnerships and new programming, which is exciting. And again, we don't ever do it just to do it. That's right. We do it because there's a need for it. And finally is just an appreciation and acknowledgement that we have now, that finally, and you will appreciate this, finally, you're starting to hear people in healthcare talk about social influences on health, housing, food insecurity, health literacy. I mean, we have in our space, right? We've been talking about this for years saying, listen, if somebody doesn't have a place to stay, if someone is food insecure and doesn't feel like they will have, they just don't know when their next meal is going to come from, or because of previous experience, they're like, I have to hoard and eat. We will never be able to support their health and well-being in the way we would like.
Absolutely.
So that is something that's really gratifying, that finally, right, we're starting to see that conversation happen.
Absolutely. I love it. So my final question for you. This video is going to be archived, right? So we know that we're going to look back 10 years. What do you want to be remembered for? So when we look back 10 years from now, I say, hey, Dr. Khatri, let's watch that video that we did.
I want to say, it's never just about me or one person. It's really our team. You know, we have a team-based model of care. So I don't want to be remembered individually. I want to be remembered, wow, the Cherokee team was, what a fantastic team. And that is, we held true to our mission in the middle of one of the worst pandemics ever in the world. We took care of patients, you know, we provided care, and we took care of each other. And so they were true to their values. Our team, our North Star stayed there. We did not get distracted. And you can't ask for more than that.
Absolutely. Thank you so much again for being here.
Thank you.
So, and for all that you do, and for our viewers around the world, I invite you to join me back next week for Wellness Wednesday. Now, you won't want to miss an episode. I want you to like, share, repost, follow, do whatever you do to share this information with other viewers around the world, just like you. Until next time, stay healthy, stay informed, and share this message. Have a great day, everyone. And I'm your host, Dr. Katherine Y. Brown. Bye.